Good afternoon. My name is Clive, and I am not a gambler. Never have been. I've tried. Been invited to race meetings by friends and associates, watched from private boxes where famous faces have been hired to come in before each race and take us through the form, offer some tips, nod and a wink. But I'm just not the sort to ever part with his money on a nod or a wink. So how lucky am I? And that should be the end of my contribution, really, because if I don't gamble, if I've never been tempted to gamble, if I can take it or leave it, then what do I know about the misery and pain that so many people in this room have had to endure at the hands of cash-rich companies that peddle a flutter in the hope that you will become one of their customers, their profit margins, their prey. And because I don't know, I might even have spent most of my life believing the industry mantra that the problem is with the individual, not with the product. I may have been and still be part of the biggest problem for all victims of the gambling addiction, convincing non-addicts like me that this is a condition, something that not only needs treating but needs controlling, maybe even stopping. I am not anti-gambling. I don't want to stop it. I am a believer in choice. But I'm not at all comfortable with the relationship between gambling and football. I'm not at all comfortable with the relationship that gambling has with football broadcasting in particular. And if you don't know, that is my profession. I'm a football commentator. That's why I stepped back from commentating for TalkSport, because it required me to read out sponsors' in-game odds. I'm no crusader. It was actually a selfish decision in many ways, something that I just didn't really like doing and something that I could stop. Call it a journalist's intrigue, call it guilt. Maybe it was just that discomfort I felt. Maybe it was Ivan Toney. But I wanted to know more about why some people couldn't stop, why and how gambling gets hold of people, good people, strong people, intelligent people, some of your people. People that know that it's getting hold of them. People that can become so disappointed with themselves and their addiction that they can't even see a way out. Because if I can understand that, if I can come to better understand how all these people, your people, happy people, talented people, can be overcome by this temptation, if I can see this addiction from your perspective, see it as a danger to the mental health and well-being of anyone, then maybe I can help in some way. I'm here at conference really more to listen and learn than offer any wisdom or advice. But if I can advise really everybody in this conference centre on one thing, is this: like every argument and debate that's held at this conference, it's got to be one outside these walls, outside this party, outside this gathering of like minds. It's the doubters that you've got to convince, the doubters and the don't knows, the don't cares, don't gamble. Why should I be bothered? It's a disease. It's an infectious, contagious disease like any other. The NHS recognises it as such. It runs gambling clinics like it runs smoking clinics and diabetes clinics and antenatal clinics. It's not just a bad habit. It's life. This government, yes, this government recognises gambling as a problem. The white paper, the long awaited white paper, is an admission that gambling is in need of more control. The gambling industry recognises it. It has its code, its own code. It has Be Gamble Aware. It even has television adverts now that seem to be concentrating on managing gambling rather than promoting more and more of it. Seem to be. The football industry recognises it. Miraculously, maybe it was just a coincidence, it announced plans to regulate itself 2 weeks before the white paper began to leak out. Regulate itself immediately. Well, 2025. There is a growing acceptance, a growing realization, a growing pressure on someone to do something. Your pressure, gambling with lives pressure, something now. Maybe that's why I'm here. Maybe I finally felt the pressure, seen some of the evidence, heard some of the concern. And I'm here to listen some more and learn some more. I'm going to introduce a panel from which I certainly will learn in a moment. A panel that understands the harm that gambling can cause and recognise it as a mental health issue. A panel that will make a very strong case to future government for more regulation in response to that issue. This is a matter for the Department of Health and Social Care at some time next year, which I sincerely hope will be a Labour department. I think a lot of people of my generation, and a lot of people of my generation still make the decisions. A gamble was a betting shop thing. Now that shop is in our pocket. Now most gamblers are not of my generation. The white paper, if nothing else, accepts the need to look at maximum stake limits and affordability checks. And where there is a will, there is a way. We're talking numbers now. How high, how low, how often, how much. There is an acceptance that we need to look at those numbers. If they want the numbers, there are people here that can give them those bloody numbers. Both government and football can live with less income from gambling and live better. That is the message that I've heard since I took my decision. And that is the message we've somehow got to get outside of these walls. And one last thing before I introduce the panel. Please gamble responsibly. It would be funny if it wasn't so ridiculous. Please gamble responsibly. It's like saying please fly without leaving the ground. It's a total contradiction. It's a nonsense. It's a slogan. It's one of those corny lines that you usually hear in a car advert. Only this is not a car advert. It's a carefully and expensively constructed ploy to get you to part with money that you will probably never see again. That's all. And I'm sad to see any number of my colleagues in sports broadcasting pocketing some of that money in return for promoting gambling. I just couldn't do that, not knowing what I know now. The message, your message, Gambling with Lives message has reached me, and now I'd like to help to spread it. I'm Clive, and thank you for inviting me. So you can see the names, and I'll introduce them one at a time. But let's start with the founder, or one of the founders of Gambling with Lives, Liz Ritchie, MBE. Liz Ritchie, whose husband Charles is also with us, and some of the other families who are involved right at the start are here. Why? Why Gambling with Lives?
So my son Jack was 24 when he died, and he threw himself off the roof at 7 o'clock in the evening. And we had to ask ourselves, why did our happy, healthy baby, happy, healthy teenager, happy, healthy 20-something-year-old who'd been through university, got a 2-1, always cheerful, why could he not bear to wait for daylight? Why could he not bear to again wait to turn his face to the sun? We have to understand this. We have to understand why. We do that with other health conditions. We did it with COVID brilliantly, didn't we? What is it that's stopping us from really trying to understand what's happening? So after Jack died, we met up with other families. I went on a bit of a mission, if I'm honest, to find other people. We were introduced to another family in Sheffield where we live, whose son had died 6 months before Jack, and then another family in the West Country whose son had died only a month before Jack. 3 deaths in 2017. And we had hundreds of meetings, going up and down to London, meeting with the industry-funded charities who were supposed to do prevention, meeting with politicians, meeting with the regulator, all of the machinery of government, to be honest. And if I'm honest, the only people who really listened seriously were the politicians. You wouldn't think that with the bad rep they've got, would you? But actually they really did, because that's their job. They hear things from their constituents, from all of us, and they try and act on them.
I'm going to try to play devil's advocate in this session. I know the answers to a lot of the questions that I'm going to ask, but I'm going to ask them anyway. The question an outsider might ask is, why didn't Jack just stop?
Because he'd been infected with a life-threatening condition, deliberately, in order to drain money from him. I've always thought that it's quite vampiric, really. It's draining the lifeblood, literally. You know, if you think of your energy for life, which is the work that you do in your life, and particularly for young men, but I mean it's true for all of us, your life energy, and you take it from the young and you give it to older, I'm sorry to say older men on the whole, who send the money that was the energy of these young people, they send it offshore. So he couldn't stop. He couldn't stop because he'd been infected with a life-threatening illness.
Okay, I'm going to introduce Dr. Matt Gaskell at this stage. He is the head of the NHS Northern Gambling Service. And so I'm going to ask you as a professional the next question. Is a gambling addiction the health issue that Liz has just described, or is it just a bad habit?
I think gambling is a lot of things, and it isn't fair to just frame it as one thing. Despite what I see every day in my practice, I'm hopefully philosophical enough to understand that there are elements of the gambling industry and elements of gambling which are perfectly palatable. It can be an entertainment, it can be enjoyable. There are certain activities that none of us are in the business of trying to stop. And I think we're beginning to really understand how gambling could be placed on a platform and a foundation where it could be structured in a particular way, where it's much more likely to be that leisure activity and entertainment that both the industry and the government for many years has framed it as. But unfortunately, it's not gambling per se that's the problem for me, from what I've observed over the years. It's the nature of the modern commercial gambling industry and how ineffective our laws and regulations have been. So, first of all, just as Clive was saying, I'm not anti-gambling, despite some of the things that I talk about, because I'm so exercised by what I see every day in my practice. I've never seen anything like it in 20 odd years of working in addictions. The elephant in the room with all my patients is the gambling industry and our lax regulations and laws. Gambling has been transformed in recent years to an activity which is placed in very deliberate environments with very deliberate products. The environment and the products carefully designed to exploit our natural reward pathways, our decision making, our natural vulnerabilities. As a psychologist, I understand the perfect storm of the way gambling is presented to the public, the way it's advertised, the way it's embedded in our national sports, the way it's embedded more and more in daytime television and radio, appealing to females and more diverse populations. I understand what engineered addiction looks like and engineered harm by the way the marketing works to profile you as an individual, to target you, to exploit you, once you've gained an attraction to this area, you've opened an account, you'll be deliberately targeted with marketing, with unbelievable offers to move you over to the most addictive products. They will not leave you alone until everything is gone. So it's a very difficult conversation to have because it isn't one thing. It isn't just about gambling being all bad and all wrong, but we have to understand the playbook of the modern commercial gambling industry, just like many other harmful commodity industries that my colleague is an expert in. They used a deliberate playbook to cast a veil over us, to soften our attitudes to this activity, to mislead us, to blind us to the reality of what's going on and what's hidden behind the glamour of the advertising that's presented to you. They will try to get as many people as desperate and miserable as possible. That's where their profits are coming from. They're not coming from those of you who enjoy a day out at the races, a Friday night at the bingo with your pals, a fiver on the Grand National. The profits are coming from intense consumption of highly addictive products. Some of you will remember years ago, Gordon Brown, quite rightly, was very cautious about the opening of these super casinos in our more deprived communities. He was right to be concerned. What we now have is a super casino in every pocket, in every home. My patients are gambling in the bathroom, they're gambling in the shower, they're gambling while they're driving, they're gambling while they're at work. They're doing everything because they've been conditioned to this behaviour and its antecedents and its consequences. It's no longer a choice to them. We have to understand what addiction is and not what's been passed down over the years as some weakness of will or something that's wrong with people. If I wanted to engineer an addiction, this is pretty much how I would design it. If I wanted to harm communities, this is pretty much what I would do. And I'm sure if the industry came up with some brighter ideas, they would be even more exploitative and predatory than they already are. So to answer your question, it was given the status of a psychiatric mental health disorder in 2013 to sit alongside all the other traditional addictions and all the other psychiatric conditions that we know. But it's worth knowing that about 85% of the harm is below the threshold of a gambling addiction. So we're not just talking about that pointy end and the severe cases, which are genuine, they're happening all the time. This is something which we need to take a grip of. We need to address the conflicts of interest. We need to allow the Department of Health and health people into this area so that they can work alongside colleagues in the Department for Culture, Media and Sport.
Well, can I bring Greg in at that point, just to say that Greg Feller's Vice President of the Association of Directors of Public Health, and this is an important distinction which the pair of you are making, because in your opinions, this is not a matter for a Department of Sport, Digital Media, whatever it's called now. This is this is a matter of public health, yeah?
Yes, with some caveats. The caveats are, and I should say, I too am not anti-gambler. I occasionally play on the lottery. I'm anti-harm that comes from an industry that is exploiting people. That's where my also concern is. So there's harm. There's medical harm, read the PHE evidence review. There's social harm, family breakups, we can all cite them, and there's financial harm. How much money goes from our poorest communities, and think, we're in the middle of a cost of living crisis. That does harm. And most of that harm is underdocumented. For me, yes, with regards to the role of the Department of Health and Social Care in this, but it's not necessarily about which government department's on point, but the approach that's taken. So for me, there's something about really nailing the framing. Anyone who's stupid enough to follow me on Twitter will know I go off a lot about responsible gambling and problem gamblers. The problem is the industry and its methods and tactics. And of note, the whole responsible gambling thing is a construct of the industry that wants to keep the dial firmly pointed on faulty individuals, term used exceptionally advisedly. And something about reframing the whole problem towards the industry and the products that the industry sells. And the framing of the problem and framing of the solution. I encourage everyone to spend 15 minutes looking at the Institute of Alcohol Studies big alcohol video. It is brilliant and it exposes it all in 15 minutes, well worth a look. Whole population, not just the pointy end of the problem, as Matt's already said. By the time folks see Matt, too late. Not too late, but many, many, many years of missed opportunities for intervention for individuals, but also let's not forget the opportunity that policy gives us to shaping environments and shaping the places that people make choices. I'm continually struck by the industry influence over the whole space across many, many, many government departments. I've worked in similar spaces, tobacco, alcohol policy, food policy, over quite a long time now. gambling is next level. I'm genuinely struck by quite how much influence there is. And you've got to think why that is and in whose interest that plays out. Yes, there's something about regulation. Somebody has to be the regulator, and in whose interests is the regulator in regulating? Who has what powers, who has what responsibilities, and who has what accountabilities? I'm responsible for the near 600,000 people who live in Sheffield. I have almost zero power with respect to gambling harm. I'm not okay about that, but that is a statement of fact. But I'm accountable for the health of the people of Sheffield. So if I have to have accountability, I want some control over some of that. Two other thoughts. On the sort of the shift of responsibility to the Department of Health, folk will say that's about treatment. Better treatment is definitely needed. There's zero doubt about that. And massive credit to the NHS that's invested heavily in that space over recent years. But we can't treat our way out of this problem, just as we can't treat our way out of the smoking and smoking harm related epidemic. That matters and has made a big difference over the years, but we also need policy. So that's a government job, whether that rests with DHSC or another department across government. I don't know that much. Don't have too strong views on that one. Last point that's worth making clear, and Matt's alluded to it. This is an industry that uses exactly the same playbook as tobacco, food, alcohol, oil, fossil fuel industries. So we need to act and make policy with that in mind. So yes, DHSC should have stronger powers, but not necessarily only DHSC. And yes, it is a disease. The vector of the disease is the industry and the product it sells and the methods it uses.
Okay, well, Paul Blomfield is the Labour MP for Sheffield Central, so no pressure here, Paul. There is a white paper on the table with more consultation. How would a future Labour government make that your white paper, and when would that consultation turn into further action, do you think?
I spent 4 years on Labour's front bench. I'm not there now. It's a matter of choice because I'm retiring at the next election. But so I can't speak for the party, but I can set out the challenges I see it. I think that I concur with many of the things that others have said. But we are at a pivotal moment now, and it's with the production of the Gambling White Paper. And Liz was very kind about politicians in terms of listening. And I have to say, people have listened across the board. I found myself working with some Tories who I would have been I don't agree with on anything else. But partly because of the effective campaigning of Gambling with Lives and other organisations, you've got people listening. And I think that there is, we've created, with the Gambling White Paper, an opportunity to act, because there is much in this that the Conservative government produced that we should welcome. I think that the challenge for Labour is how we help to shape it over the next period, because the government are going to try and do as much as they can on implementing it before the next election. So as an opposition, we've got to be trying to shape the debate, as well as what we do when we're in power. And I think that the challenges for us are to put things right, because the current framework within which gambling operates, which has been rightly criticised, and I think we've got one of the most lax regimes in the developed world, was set out by the Labour government in 2005. Now, I'm not blaming colleagues. I've got some good friends who were in that team. I think that they got it wrong in the big casinos, and Gordon was right to call that in. I don't think they anticipated how the world of gambling was going to change and how everybody would have a casino in their pocket. And so the rules that we put in place are spectacularly unfit for the current gambling environment. So we've got an opportunity to put things right from the 2005 Act. And I think that there are probably three things that we should do. We should recognise the positives in the white paper on the statutory levy, We should make sure it's set at a level which will enable proper treatment, proper public health messaging. We should ensure above everything that it is completely independent of the industry. The industry has been so effective in embracing critics and seeking to turn things against themselves. I mean, I'm a big football fan. I've listened to you many times over the years. And I sit there at Bramall Lane, which is not a great experience in and in the days gone by, watching those adverts flash by, stop when the fun stops. So that the industry had created a subliminal messaging, even in the public health messaging, which is saying gambling is a great thing to do. So I think the importance of independence in the future architecture from the industry is critical, and that's also in relation to the ombudsman that's being proposed. I think the second thing is that we do, and the theme of the meeting is hugely important, that we locate it as a public health issue. And I slightly disagree with Greg. We've disagreed on other stuff in the past, but he's usually right. But I think that it is important that we move the responsibility from DCMS and land it in health, because most of the statutory levy is going to be used in treatment. Treatment is a health issue. Most significant amount of it is going to be used in public health messaging, and that should be driven by health professionals and nobody else. I think that we have now won the argument that actually gambling addiction is a health issue. So I think for all of those reasons, it's important that it's there. And I certainly concur with the points that people make that we should fundamentally shift the narrative away from gambling being a problem for a few individuals to gambling being a problem with addictive products. Designed not because people are maligned, but because the gambling companies want to make money. Products that are designed to encourage people to spend more money. And I think, thirdly, we should, and it's the one area where I think the white paper fundamentally falls short, is we should do something about sponsorship and advertising, because we know how pernicious that is, particularly in football, and particularly encouraging young people into gambling and into the appalling levels of gambling addiction that we've got.
Liz, what would you like to see happen in terms of regulation and legislation?
First of all,
You'll need a microphone. Even you.
First of all, I'd quite like to slightly challenge Matt and Greg and just talk about the deaths and focus minds on the deaths. They aren't just happening to the severe cases or the pointy end of the problem. I mean, I'm not sure you actually said that, but
No, I said don't, not just the point here.
no. Okay,
Yeah.
good. Okay.
And I said, don't forget the 85%.
Okay, fine. You successfully rebutted.
Can I ask, what was the fact that was told to me last night that 90% of the profits come from 5% of the gamblers? Is that right?
Yeah, I'm going to bring in Charles.
Absolutely.
No.
No, tell me, Charles, quickly.
Come on, Charles.
Well, you said the fact that for online betting,
Online betting,
90% of profits.
90% of profits.
Sorry, probably technically it's 86% of profits come from 5% of people. So in other words, you've got a business model which is built on addiction.
Okay, right, we'll establish that. Carry on.
So I just wanted to talk about why I continue to want us to ask the question, what is causing the deaths in this addiction? And I've got just two cases that I'll do it very quickly. The families are not here today, and I'm going to anonymise it. Young man A, late teens, only gambled to any extent for 7 months. And the first couple of months he made a profit, started gambling on sports, but was cross-sold to casino games. So again, the products, and deliberately cross-sold, and started doing the in-game betting, which is like a casino, but with sports betting. And the 5 months consistently lost not much money, and he was only late teens, so he didn't have much money. Hundreds of bets or spins per day, between 100 and 200. Crashed out on the last day and only lost 150 pounds, and he died that night, took his life that night, in his family home. Contrast with case B in his early 30s, and he gambled for years, large amounts of money, mainly casino games again, losing and winning, a much higher activity rate, 700 odd spins per day. So 700 spins per day, I mean the speed of that. So we know that speed is really important in terms of the addiction. Gambling during the night, a clear indicator of harm. We have, these are contrasting to some extent. You want to say something, Greg? That's fine.
Can I just ask Matt quickly, is there a typical victim?
No, there isn't.
Which is kind of what we're establishing.
Yeah. What
It could
causes
be
the
anybody.
death? Is what I want.
I mean, it's very common for our patients' lives to be characterised by stability and by nurturing parenting, by being popular. Just happen to be perhaps sports lovers, happen maybe to have an early big win, which is sometimes called, where who is an 18, 19-year-old, if you win a few £100, who isn't going to get excited by that and want to repeat it? You don't need to be a rocket scientist to start to work this out. And the difficulty is then you want to gravitate to have that feeling again, and you want to have it more regularly. So you move to products, and the industry will want you to move to products where you're likely to get that hit at a much more rapid basis and constant basis and continual basis.
Okay, Greg, sorry, what's the point you wanted
Just
to make?
to underscore the need for the whole population thing, few would disagree. In fact, very, very few would disagree, apart from some industry arguments, which is all about the 0.3%, leave the rest alone, etc. Most strokes happen in people who've got normal blood pressure. Most strokes happen in most diabetes cases are diagnosed in people with normal blood glucose. The notion that if only we could find those people and we could screen them and Mac could treat them, it's an anathema to good quality public health policy. The business end of this is product availability, price, marketing, and good treatment for whole populations.
If I could just come back to Matt for a moment. How? We're talking about, we're painting a picture here of the gambling industry, which is very, very clever and very, very smart and almost demonic. How? What are these methods? I mean, how are they so successful?
Again, I go back to what I was saying, that it's not necessarily very sophisticated. As a young man, again, if I'd won that amount of money, I'd want to repeat it and I'd want to keep going. When I think of my patients, we have patients who are on benefits, who are so addicted they lose everything the moment their benefit check hits, everything within an hour or two or three, all the way up to people on very comfortable incomes who are flown all around the world on VIP trips by the gambling industry to spend more and more money, who lose everything. They lose their business, they lose their family, they lose access to their children, they take their lives, they go to prison. It doesn't discriminate. Yes, it does affect deprived communities more so, and we can see that with the online data, and we can see that with the way that bookmakers are clustered on our high streets in more deprived communities. We know what the industry are doing and who they're targeting and who can least withstand that harm. I forget your question, Clive.
Well, I just how they did it, but I think people don't know.
Yeah, it's a combination of mass advertising and the way that's presented to the public, the glamour, the excitement, the ease to win money, the celebrity endorsements, the targeted marketing, the deliberate nature of products, where I just very briefly ask you to distinguish between a bet. My dad used to bet on the pools a long time ago. He places bets on a Wednesday for the matches on a Saturday afternoon. They were all on a Saturday afternoon in those days. Versus somebody who's live in the action, watching live football matches with several screens in front of them, bet after bet after bet after bet after bet. It's very easy to structure the gambling industry where there's a distance between your bet and the outcome and your ability to gamble again. If you structure it where it's based on intense consumption, where you've got high frequency betting and you've got highly addictive products which encourage that high frequency continuous betting. Online, making it significantly more risky as well. You've got a perfect storm for harm, for addiction, and I'm afraid for death.
Paul, as MP for Sheffield Central, and we don't have to have visited Sheffield Central to have an image of Sheffield Central and one or two of the community issues that you may have to deal with, drugs, drink, whatever, abuse. How big an issue is gambling now, and how big an issue was it maybe 10 years ago?
Well, I think Sheffield has all the same issues as, most major cities. I mean, I'll tell you one thing that's kind of an interesting reflection on that question. When I first met Liz and Charles and talked about Jack's death, it really struck me. And I talked to one of my staff and shared that experience with them. Now, I had always seen gambling as something that was kind of marginal. My granddad gambled. My uncle ran dogs. It was kind of at the margins of life. And I was talking to one of my staff, and he said, "Yeah, we gambled all the time at university." Now, one of the things you don't know about Sheffield Central is it has more students than any other constituency in the country. And I hadn't realised just how normalised gambling had become right across society. And I think that's the most striking thing.
And you can't spot a gambling addict as they walk through the centre of Sheffield. You can probably spot somebody who's high on crack cocaine, but you can't spot somebody, maybe even the parents.
Absolutely, but also
It's a silent problem.
Yeah, it is. I'm silent one time without the microphone. What's really important is that we as families have been deprived of the information to enable us to save our children. Deliberately deprived of that information. You know what to warn your children about. You think you know. If you're a caring parent, if you are somebody who's vigilant, you warn them about all sorts of things, road safety, drugs, and sexual predators, all of those things. We have been, as a society, we've all been groomed. And as families, we have been groomed. We've been told lies about what would be the right thing to do to save our children. We sent Jack some money just before he died because he was abroad and he couldn't bear it. His suicide note said, "I will never be free of this." And that's what people feel. And because the people who died, they don't know, they've been groomed, they've been deliberately misinformed about what's wrong with them. They've been told it's their fault by the responsible gambling model.
Yeah, the stigma issue is something we'll discuss, and I'm going to open this to the floor after just one more point, and can we just get the microphone to James Grimes? Because if I can bring this back almost to where I started, football and gambling, which is my industry, I would come across people say, yeah, but it's really, really important now. We want a new striker, and without gambling sponsorship and so on, that's all our clubs got. How dependent has professional football come on gambling money now?
Well, I think one of the biggest myths is that the football industry is reliant on gambling. The reality is the gambling industry is reliant on football. The gambling industry makes billions of pounds off our national sport and puts a tiny, tiny percentage of that back in just through more advertising and sponsorship to get the next generation of gamblers. And the actual figures are a gambling sponsorship ban would cost football just 2.5% of revenues. So don't believe that myth would be my message.
Okay, we'll try to establish some more facts as we go. We certainly have people here. I'm going to ask some questions. I'm going to ask, if it's okay, those of you who are part of Gambling with Lives, know all about Gambling with Lives, can we just listen today? We've got lots of outsiders here, and in many ways, I think it's more important we hear their questions so we can know how to take our campaign forward.